All right, we are at 5:03, so I'm going to get us started here so we have the full hour. Alrighty, I'm going to kick us off. So hello, everybody, and welcome to our Autism Exploration Series. I'm Dr. Emily Sampone, the Director of Clinical Operations at Verbal Beginnings. Verbal Beginnings' mission is to change lives for our clients, families, and our professionals. We do that through our pledge of care, which is our promise to you, to provide effective treatment through compassionate care. We also strive to achieve our mission through our core values. One of our core values is education, teaching families valuable ways to work with your child. And that's why we decided to start these series. Additionally, you'll see the seal of the Behavioral Health Center of Excellence and the seal for the Autism Commission on Quality. Both of these seals represent the hard work and focus that we place to ensure that VB is providing quality care through the highest standards. Next slide, please. I also wanted to take this opportunity to introduce you to the services that we offer here at Verbal Beginnings. In addition to our in-home and center-based ABA services, we also offer center-based comprehensive services, feeding therapy, and social skills programming. Additionally, we encourage you to participate with us today throughout the presentation by using the Q&A feature found at the bottom of your screen. We also offer closed captioning during this recording, which you can access by navigating to the bottom of your Zoom screen and clicking the closed captioning button. Okay, without further ado, I'm excited to introduce you to our presenter for the evening, Dr. Pranali Goyal. All yours, Pranali.
Thank you. I appreciate that introduction. Well, hi, everybody. I know we have not conversed or met before, but I'm Dr. Pranali Goyal. I'm excited to present today on the topic of mindfulness and how it relates to play skills. A little background on me. I am in New Jersey. I've been a BCBA since 2014. Prior to that, I've worked in the field of behavior analysis since 2001. My first experience was actually in a private school in New Jersey as a paraprofessional. And then I continued to become more and more interested in the field of behavior analysis. My interests continued to grow. My bachelor's degree is in special education. So I'm a certified teacher of the handicapped in New Jersey. I've taught actually in public schools over my career as a special education teacher in both resource, inclusion, LLD, and BD settings. So I have a lot of that classroom-based experience as well, which I think really helps me support the teachers and really helps me understand the parent perspective when they're going into school settings. I've also taught across public and private schools. I'm also a professor at Purdue Global currently, and I teach a course in applied behavior analysis. Both my master's and PhD are in behavior analysis with a thesis that focused on conditional discrimination, which is basically teaching children to discriminate between different objects and stimuli and how they match categorically. And then I also had my dissertation focused on a different topic within behavior analysis, specifically on mindfulness and parent-child interaction. So we'll talk a little bit about my study, but it's not going to go into like more the clinical aspect, the data, but what we found parents and how it increased the interactions during playtime for parents in particular. The current areas of interest for me are mindfulness-based interventions. I've been doing social skills group and providing adult services as well as services to staff during staff trainings and to supervisees that I oversee that are pursuing their master's or degree in behavior analysis. So social skills, play skills, and then obviously the compassionate care component that Emily kind of spoke about, as much as we in the field have come such a long way and we want to continue to practice in a compassionate way towards our clients and keep learning to invent, be more inventive and contact other research and other fields as well. I've been featured as a guest on a couple of podcasts. I provide consultation through my company, which is called Neurodiversity of Northeast, across clinics, schools, and programs. And that's a little bit about me. So as Emily mentioned, we're going to have a few poll questions, especially since we have a smaller audience. I think it'll be nice to be a little more interactive. and kind of have me get to know what your background is, if you've ever heard of mindfulness, if you've practiced mindfulness. I'm curious to learn a little bit more about you all as well. So, first poll question, if Emily, if you want to launch that. So I'm gonna give about 20 to 30 seconds for everybody to respond. Anybody else wants to participate? And the poll, it seems like we have kind of even out numbers. We have some that are parents and some that are not. So those of you who are not parents, you can still practice the skills that we're going to be learning, and sort of the overall treatment of mindfulness and as an intervention is not as complex as like what you might see in a typical ABA session maybe. So what we might be learning can really be applied to your own life or even for clients that you might be servicing now. Okay, so next poll question. And if you don't have children, if you can either respond NA or you can also respond as maybe something you might be doing with your client currently. Okay. Seems like not everybody has responded so far. So we're going to give it another minute. Okay. It seems like a lot of you are spending about 15 to 20 minutes, not all at once, maybe, playing with your children. So that's good to hear. So that's our results from that poll. So that's good to hear. So playtime obviously can be really difficult, especially when you have other things that might be occupying your time, especially for some of you who shared that you have other children in the home. So siblings, if they're younger or if they're older, can definitely occupy time from a parent. And depending on your situation, if you're a two-parent family or even a single parent family, and if you're working, that can also be a factor in how much playtime you have, especially one-on-one playtime with your child. Okay, so that's good to know. A little bit of, so some of the things that we'll talk about is increasing that present moment awareness during playtime with your child. So I know with playtime, we talk about playtime, but looking at playtime specifically from a mindfulness perspective. So it's not playtime where you're doing a task or you're working on cooking dinner or whatever that might be, and the child is playing next to you. It's playtime where you're actually having interactions back and forth. You might be playing with something together or playing with something at the same time, but not necessarily interacting. So, what that's going to look like based on your child's skill level, right? And depending on their developmental and chronological age as well. So practice brief mindfulness-based strategies during playtime. So how can we do that? How can we incorporate those things while we're engaging in playtime? And then learn about different play skills throughout a child's development. So I'm sure some of this information for those of you who are parents or even those of you who aren't might be some things that you might know and some information might be new to you. So if there is a question that you have once we get into the content, please let me know. I'm happy to stop and answer questions if you want to put questions in the Q&A. Just I want to make it as interactive as possible. Okay, so next question. Have you ever meditated before today? Seconds. Seems like most of you have, so that's good to know. So we'll do a brief mindfulness exercise. Obviously, if you're driving, please be careful. You're not going to close your eyes or do anything that could jeopardize the safety of you or any other individuals that are with you right now. just, find a quiet space. It could be in your home or wherever you are right now. Or if you are driving, just try to focus on the road, and we'll do a quick, brief mindfulness exercise. What are the biggest barriers to practicing meditation? So I know this is another factor that I'm curious about, especially from those of you who are parents who might want to practice meditation but can't find the time. So that's the next full question, Emily, if you want
For
to.
some reason, it won't let me launch it. So if you're able to respond with 1, 2, or 3 into the Q&A box, that would be our
Oh, yeah.
workaround. For some reason, it won't launch. Sorry about that.
Let me see if I can see the Q&A box.
I see a 3 and a 2 come through so far.
3 and a 2. Okay. So not a part of my daily routine. So that's
And
something
another 3.
weird. 1 and 2. Okay.
Yep, 2 threes and a 2.
So threes and a 2. Okay.
Not to
I can't.
confuse anything.
No, that's. I can't see the Q&A response. I can tell that there's 3 responses, but I can't see them. So
Okay, cool. I'll read them out to you then.
yeah, that's perfect. So we'll practice a quick, brief mindfulness exercise. It's only, I would say, 5 minutes long. So just find a quiet space. If you have never practiced it before, it's, you're not expected to feel differently afterwards. You may feel differently afterwards, but just take it. Have any thoughts that are going through your head, that's fine. Let them continue, and just focus on your breathing. Just in through the nose, out through the mouth, and that's all you're going to focus on while this is playing. Works perfectly.
A meditation for self-compassion. Wherever you are, whatever you're doing, take a minute just to relax your body. Bring some ease and relaxation to your shoulders, to your jaw. Release any extra tension that you may be holding. If you're sitting, settle into your seat. If you're standing or walking, settle onto your feet. Taking a minute to just feel your breath rising and falling. To feel your body in this moment, in the midst of anything else that's going on, present and aware. Take a minute to notice where your breath is most prominent, whether it's your belly, your chest, or at the very tip of your nostrils or somewhere in between. And just feel the inhale and the exhale. Notice how long each inhale and exhale takes. Notice the movement of the body. Bring some ease to the breath if you can. Take a minute to notice where in your body you're feeling your strongest emotion. That might be exhaustion, it might be impatience, anger, confusion, sadness, whatever is the most prominent feeling at this moment. Notice where it is. Notice what it feels like. And if it feels comfortable and your hands are free, feel free to bring a hand to your heart or to your belly or both. And with your palms, bring a sense of care and compassion for yourself in whatever you're experiencing. Rather than thinking about whatever is troubling you or whatever is difficult, exhausting right now, see if you can drop into the physical sensation. Feel the movement underneath your palms. Breathe into any tight, difficult, heavy, challenging place. Imagine holding this difficulty like you would your baby, with kindness, forgiveness, and care. Keep breathing. Imagine your breath washing over any pain, any struggle. Bringing you strength and comfort in the middle of this very difficult time.
Okay. Well, thank you for those of you who participated. So I have another quick poll question. How do you feel post meditation? Oh, good. This one launched. I'm happy to see that. More aware. Good. Yeah. Pleasant calmer. Yeah. Some of you might feel the same as before, and that's okay. Okay. So I know that not everybody's going to feel differently, right? Especially if you're practicing it for the very first time. You might be also in a position where you're distracted by something else that's going on in the environment. So, one thing I will say, it takes a lot of practice. Obviously, it's not going to be an immediate result that you might feel from, let's say, if you're feeling stressed or angry, lashing out, for example, is always going to feel better, right? So when we talk about it from like a reinforcement perspective, that anger, that outburst that you might have afterwards, you're going to feel a little bit better, regardless of what outcome or consequences that might come with it. You might feel calmer just from having that interaction or just releasing that anger. So it's the same thing with, it's not the same thing with meditation because it takes time to one, calm your thoughts down, especially when you have distracting things in the environment. Typically with meditation, anywhere from 6 to 8 weeks is what they typically recommend. Most of the research, especially the research that I did as part of my dissertation, recommends anywhere from 8 to 10 weeks. Now, for the research purposes, I did an 8 week study with parents who participated. There were 3 sets of parents who had children not on the autism spectrum necessarily, but children with other concerning behaviors or something that was happening within their lives that required for them to engage in mindfulness practices so that they could be more present with their children. So it's not just, necessarily that if you have a child with autism spectrum that this is something that you should do. It could be really done by any parent or anybody that's looking to practice this type of procedure that's easy to implement, sort of make it a part of their daily routine, but also, try to see what changes in your mood and behavior are happening sometimes after a few weeks of practice. So that's something, first thing we have to do is be aware of that, right? So whatever it is that you're trying to reduce, whether it's stress or maybe anger that you might be feeling or resentment or, something tragic might have recently happened in your life. So whatever it is that you're trying to resolve, essentially, the practice of it is going to take some time before you see the actual results of it. So just keep that in mind. So consistent practice of mindfulness leads to a dispositional tendency to be mindful in everyday interactions. So it's not just about, you know, it's not like you're going to completely be reduced of your stress or you're never going to have a reaction when that person cuts you off on a highway or something like that. I certainly don't feel that way. And I've been practicing mindfulness meditation techniques for almost 2 years at this point, maybe even longer. So it's not, I would say that there's definitely situations where there's acting with awareness. So even when you have those reactions, observing it, describing it, not being judgmental about it, or not reacting to the reaction that you just had. So it's also about being mindful of how we're feeling, what environment are we in, what sort of things bring us natural calmness. So being in nature is definitely something that I do a lot to kind of feel like I'm present in the moment, that I need that environmental factor every time that I'm engaging in these types of meditations. But for some people, it might be just as simple as sitting with a friend and having a chat. There could be that interaction that might be happening every day where you can become more mindful and more aware. So it's not just sitting down and meditating. And I think that's another thing that gets misconstrued, I guess, with mindfulness is that you have to sit and meditate. Yes, that is a big component of it. But what it leads to is also how we look at life and what we notice within our environment, how we are interacting with others. Is there certain factors in these interactions where we can be observing it and, you know, doing something differently afterwards? So that's also a level of awareness that does happen. Okay. So now shifting from that mindfulness perspective, I wanted to give you a little bit of background on mindfulness first so that the understanding is that, as we practice these skills, it does become evident in the play that we have or the interactions that we have with our family members and specifically children, especially because the topic of this is play skills. So as we talk about play skills, we talk about how children naturally develop play skills. Now, this is going to vary, especially when you're dealing with a child with a developmental disability or learning disability. So just keep that in mind. So unoccupied play is something that happens from that birth to 3 months. This is when the baby is engaging in movements or exploring their environment. They're not crawling. They're not moving towards an object maybe necessarily at the speed of like a toddler or somebody who's starting to crawl. But from birth to 3 months, they should be looking around and exploring. They should be trying to grasp things that you're trying to hand them. So that's something we look for as early on as birth to 3 months. Solitary play, that's one of the longest, I would say, beyond the 4+ years that, a lot of those play skills are being developed. So children who play solitarily at the age of like 6, 7, and they're just still not interested in this in their peers, it could be that there's some solitary play skills were not developed well. And if you're lacking some of those fundamental developmental play skills, then you may not be necessarily progressing towards that parallel, associative, or cooperative play. So just, something to always keep in mind, especially when you're developing your treatment plans as BCBAs and therapists, when we're implementing specific programming to teach leisure skills or play skills, we need to keep that in mind is, can the child sit alone and play? And how long are they able to do that? And a lot of times you'll see BCBAs doing preference assessments specifically for that. So they're looking at how long does the kid engage in a specific toy. And this is where, it's going to be really important to build that time where the kid is actually just literally just sitting and playing. So there's no demands being placed on them at that time. They're not supposed to be playing with it a certain way. They're just supposed to be playing. So that happens when the child plays alone. They're not interested in playing with others quite yet, and that's okay. So that some of that programming, especially when we go and evaluate children, and if they're not able to have that solitary play, and we're moving to like programming that's requiring them to now take turns or play board games or any of those more complex skills, you may have difficulty where the child is either takes a very long time to learn the skills or is engaging in some problem behaviors to avoid that altogether. So just keep that in mind too. Spectator onlooker behavior. So that happens around 2 years where the child is like watching others. So this happens a lot at playgrounds. If you see in a preschool setting, kids will watch other kids play first and then they'll, maybe go and do some imitation of that or try to engage in the same play later on at a different time. So they're observing that, but they're not necessarily joining in. They're not at that cooperative play stage yet. The next thing that happens at 2+ years is that now they're playing next to each other. They might play alongside, but they're not necessarily playing with the same thing, but they will sit together and play. So parallel play is so crucial to play skills, and a lot of times this is something that does get missed. And I see this, unfortunately, a lot in programming, where parallel play is just not being addressed at all. But the kid is moving right to having a kid taking turns with them or having to wait for an item when they want the item. So if they have not developed all of these prerequisite skills, it might be really, really challenging for a kid to then start sharing toys or engaging in interactions about what they're doing during that play. So just keep those things in mind as well. That associative play, which happens developmentally at 3 to 4 years, it's when they actually start to interact during their play. They're not a large cooperation required. So one thing we have to always keep in mind is kids need to be able to just play without having to be dictated how they should be playing. So a lot of times it's just sitting next to the child. And then once they really understand that they have this free range to play, then they will start to involve you. There's not a lot of cooperation required, which means they're not being told like, put the doll here or put the baby in the baby rocker and rock the baby. So none of that is happening, right? But a lot of times in programming, we'll see that as being a target. So just keep all these things in mind when you're programming for a lot of those play skills and leisure skills types of programs. Cooperative play, which happens 4+ years. So this is essentially that last stage of play skills. When the child plays with others, they have interest in the same activity and other children involved in playing. When you look at sports, when kids really start playing competitive sports, it doesn't happen till like even after kindergarten, first grade, second grade, third grade. I mean, from my own experience with my kids, I know they didn't play really that competitively up until third grade, which in some sense could be a little later than, what some kids might need. But a lot of these basic play skills have to be in place before the kids can now go be on a soccer field with other children and then follow the rules of a soccer game. So keep those things in mind as well. So regardless of their age, if they're not, even if they're chronologically at the age of 8, but developmentally functioning at a 2-year-old level, they might still be at that parallel play stage. And we might not get at that point where they can join a soccer league or be in like a play environment where they have to take turns or wait for items to be delivered to them for long periods of time. Okay, so let's see if this video works. This is a quick video on different stages of play. Yes, the link is working. Sorry. Before I move on, Emily, were there any questions in the Q&A that I missed?
Nope, I haven't seen anything come through.
All right.
Pranali, for some reason the audio isn't working for this one.
Say it again.
The audio is not working on this one.
Oh no. That's too bad. Let me see. Audio settings. Sorry, guys.
It's funny, the other video worked
The other
perfectly.
video worked particularly. Maybe. Did it not work after I made it full screen, maybe?
I don't know.
Try. Get out of full screen. If it will let me. Sorry about that. Is that better or no?
No, it's
You
not
still don't
working.
hear it?
Mm-mm. So odd.
Hmm?
It's so odd. The other one worked well.
I mean, I could put it on, let me see. The closed caption. I mean, a lot of it's just observing. It's mostly just observing it's just music in the background that you're not hearing. That's really it.
Oh, okay.
Yeah. I like this video because at the end it says play starts with, when you're a baby and just should never stop. You should always be playing um, as many opportunities as you can get to play freely with kids, as many as many times a day as possible, I would say. All right, so I don't know why this is not sharing the way I was sharing it before. Right? It's sharing. Is it sharing correctly? Are you still able to see everything I'm doing?
Yes.
All right, good. Okay, so we were just on this slide. There we go. Okay. So play is essential, obviously, for social, emotional, cognitive, and physical well-being, but it also teaches other skills like problem solving, collaboration, language skills. It leads to social emotional learning, executive functioning skills, so organizational skills, and leads to safe and nurturing relationship. So play is extremely important between a parent and a child, and how we start play from a very young age, and what we model for our kids and how we interact with them during play is very, very important. So how does play and mindfulness connect? So essentially, I'm sorry, you're seeing the other tabs and I don't know why. I apologize. There's nothing there, so so listening with full attention. So effective parenting behaviors promoted through this practice is correctly discern child's behavioral cues, accurately child's verbal communication. So sometimes even repeating back might be what they're saying. Sometimes even agreeing and then giving them something back. So having that back and forth instead of, when they're having that interaction with you, fully attending with that full attention rather than responding, like an offhand comment type of thing. And sometimes that can be really, really challenging and difficult. So it's always good to have like a time of day where you know that you're going to be not be distracted, you don't have something to attend to, something else isn't going on, somebody doesn't have to be picked up or whatever it is, and try to have like 5 or 10 minutes, whether that's in the car when you're alone with the child, when you're, bringing them to something, or at the end of the day when they're in bed and you're just sitting there for 5 minutes before bedtime. So whatever that might be. So parenting behaviors decrease through this practice, reduced use and influence of cognitive constructions and expectations. So, kind of just always paying full attention of what's happening within the environment. What is the child trying to communicate with you, essentially? Non-judgmental acceptance of self and child. So healthy balance between child-oriented and parent-oriented and relationship-oriented goals. So what are child-oriented goals? What are parent-oriented? And what is the goal of the relationship between that parent and that child? Sense of parenting self-efficacy, and then appreciation for a child's traits. So fewer unrealistic expectations of child's attributes, reduction in self-directed concerns. So having our own biases essentially and our own fears projected. Now, we all do this as parents, and it's very difficult to sometimes let go of how you've been brought up yourself, speaking from personal experience as well. So it's something to always be aware of. It's not always necessary to look at it as a bad or a good thing, but rather than it might be something that might influence how you are going to react with your own child. So just keep that in the back of the mind. So that's a bias that you might have from your own childhood. And is that what you want for your child, or is it that you want to use part of that and still develop a different way to parent? So that's really also going to be on personal preference, your cultural values, religious values, even, whatever that might be. And that's something you as a family, that's going to be the relationship part of that goal, right? Your parent oriented and child oriented should not be involved in that, if that makes sense. And then emotional awareness of self and child. So what are your responsiveness to their child's needs and their emotions? How do you feel when or certain things, certain emotions are happening, or certain needs are not being met for your child? Greater accuracy and responsibility attributions, and then less dismissing of child's emotions. So not, saying you're overreacting, and it might be in certain situations your child might be overreacting, and this definitely happens. Or it might be a situation where the emotions are high because of situation is severe, but it's really just being more aware of that, and then how do we resolve it afterwards? Less discipline that results from parents strong negative emotion, so anger, disappointment, or shame, right? So self-regulation in the parenting relationship, how do we do that? Emotional regulation in the parenting context, so again, making those few minutes a day to do either a mindful walk, a mindful meditation, writing in a journal, whatever works for you. Within the study, when I had parents practice mindfulness skills, we had two different treatment options, and both parents chose both. So we had one option where they did a 10-minute mindfulness meditation with me over Zoom, similar to what we practiced before. And then they would go right into a play session with their child. And then I would be watching over Zoom, collecting data on specific components that we were looking at as part of the study. And then the other component of the treatment was that they would be already in a play session. So they would schedule a 10-minute period where they were not going to be interrupted. Their phone was off, phone was on silent, TV in the background. And we created the environment where the specific toys were available to play with that the child already selected based on their preference. And then the parent and child were already going into a play session as I would observe. And then every 30 seconds, we did a mindful bell. So, and then each parent chose a visual that they would look at during the mindful bell. So one parent picked a picture of the ocean, another parent picked a picture of trees and nature. So it really, and both parents found each beneficial for different reasons. But because we had both parents choose both treatments, it was hard to compare which one was better for which parent because the results looked a little bit different. With one treatment, they felt like it was easy to implement and they could set a mindful bell on their phone and kind of continue that afterwards. Whereas the other one, where they actually had to sit and do the meditation, was a little more time consuming. So those were the factors. But again, and that those are some different ways that you can definitely incorporate. Like I have a mindful bell that goes off every 2 hours just to remind me to breathe, especially on days where I know I'm going to be very, very busy and I may not get time to meditate until I'm pretty much in bed. So it really depends on what works for you and how you can incorporate it into your busy day, essentially. Um, and then last but not least, compassion for self and child. So we're all humans. We're going to make mistakes. We're going to have reactions. Approach it with compassion, positive affection in the parent-child relationship. So that what we call in our field is non-contingent reinforcement, but it's just free affection, essentially giving a hug for no reason, or just being there and doing something that your child might enjoy, whatever that relationship you have with your child. More forgiving view of own parenting efforts. So, not always being judgmental about what we're doing and how we're failing as a parent or how we could have done XYZ better. Less negative affect displayed in the parent child relationship and less self blame when parenting goals are not achieved. So, setting more realistic goals for ourselves as well as parents. Okay, so this is a little bit of a visual as well.
Hey,
Um,
Pranali, I have a question that came through. Would you like it
sure.
now or later? Yeah. Okay.
Yeah, no, it's fine.
Okay, cool. One of the participants asked, if I have a client with a developmental disability who is stuck in parallel play phase, but not yet ready for cooperative play, which they have tried, is
Mhm.
it possible that they just enjoy playing alone? Would you push this skill? And if so, how?
So I would go from parallel to associative play instead of going to cooperative. Cooperative comes after. So go to the associative play where kids are in the environment, they're playing, and then, what we also, one thing you can work on, and this is, I don't want to get too clinical, but you can work on some joint attention skills and then see if the child is interested in observing others or looking onto others for play as well. I hope that answers the question. Okay. So one of the visuals that I have here, and I know we're running out of time, so I don't want to take too much time on this, but this is some theoretical foundations of mindfulness and parenting. So mindful parenting, like we talked about, um, communication, parent goals, parenting self-efficacy and realistic expectation, parent well-being, fewer psychological and physiological symptoms, better emotional health, more positive interactions, child management practices, consistent discipline. So that's, goes into a very big picture, obviously, but decide like what's this, what's the level of discipline you're going to have for something like if they forgot to pick up after themselves versus they got into a fight at school. Okay. And make those rules and disciplines very clear to your children too. So having that communication. Now, it might be very challenging when you have a child with developmental delay, but that's where consistency is going to matter even more because they're going to know what to predict when certain things happen. And that's something you're going to work on with your therapist, your BCBAs, and your support system as well. And then youth problem outcomes, fewer conduct problems, less substance use, youth positive outcomes, child well-being, and self-regulation. So these are all the benefits of mindful parenting. There's a book by John Kabat-Zinn, and he's actually one of the first people who sort of introduced mindfulness to the Western world in a sense because he started using it. as part of his practice as a medical doctor to treat patients with anxiety and different medical conditions. So after 8 week of practice in specific doing mindfulness exercises and um, continuing to follow the treatment, they were able to see lots of different effects. And him and his wife have published a book. It's called Mindful Parenting, something I definitely look at for a resource at times as well. So parenting sense of competency is something we did as part of my dissertation, just to kind of evaluate that social validity perspective. Because we had a lot of data. I'm sure Emily will can tell you one day, but she collected a lot of my inter-observer agreement. So there was a lot of data that was taken on specific behaviors, but we also wanted to get social validity, which was my biggest component for the study, is how do the parents feel before and how do the parents felt after. So the parenting sense of competency is basically a questionnaire. After mindfulness interventions, parents reported that they felt like they had a higher rate of parenting sense of competency. They reported more present moment awareness. A parent told me she played with her children for an hour in the rain and it didn't bother her that her kids were dirty afterwards, and she just enjoyed that time in the rain with her kids, and it's not something she would have ever done before. Parent-child interactions increased during play after 6 weeks of mindfulness meditation. So when we initially started, the kids were, the parents were joined in the play, that the kids weren't interacting back and forth. And one of the things that we talked about when we went into treatment with the parents is that they were not to start asking questions just to elicit responses from their child, that the interactions had to happen naturally. But they can do some praise statements or talk about, like, how they're enjoying playing with their child and things like that. So those were some scripted statements that were given to the parents prior to going into the play sessions. Okay, so this is just a copy of the parenting sense of competency scale if you're interested in looking at it. It basically has questions and parents rate them from 1 through 6 rather. So 1 is strongly disagree, and then 6 is strongly agree. And the questions are: the problem of taking care of a child are easy to solve once you know how your actions affect your child, and understanding I've acquired. So when we did a pre-test, parents scored it, like some parents scored like a 2 or a 3, and then post mindfulness intervention, they were able to score at like a 5 or a 6. So that was a great social validity to have. So some ways to practice some simple play skills. So ensuring to reduce the number of toys in the environment. This is one of the first things that, I as a clinician have done over the course of the years, is when I go into a home or if I'm providing parent training, one of the things I always ask the parents to have clear bins so that certain toys can always be put away and they're not available to the child at like just free access, essentially, especially when you have a kid who is non-vocal, who can have access to anything without having to really ask for it or request it in some way appropriately. Then you want to reduce that, and you want to just keep a few things out and then start to interact with those toys and then rotate them every couple months, so that once they start to like maybe satiate or lose interest rather in the toys that they've been playing with, then you have something that you already have, but it's necessarily not something that they've played with. Select time that might be least disruptive, right? So even if it's 5 or 10 minutes, if you know that after dinner time is the best time for you, right before they take a bath and go to bed, then that's your 5 or 10 minutes. Turn off any notifications, silent your devices, set a goal to engage in at least 5 minutes of play without interruptions. And it can be anything that your child has picked. It could be even going to the park together and going for a walk. It doesn't have to necessarily be toys. Okay, some of the resources, I gave you a link for podcast that I did with Autism Weekly, and that was all I had. Thank you, everybody. I'll hand it over to Emily.
Awesome. Thank you so much, Pranali. This was really wonderful, and I hope that everybody that's in attendance found this to be just as enjoyable as I did. I encourage everybody who is here, if you have any questions for Dr. Hoyle, please type those into the Q&A box. We have a couple minutes here, so anything play related, mindfulness related, I'm sure Dr. Hoyle would love to field for you. So while you're typing questions in, Carly, if you want to go to the last slide, I'll just present that out to them while we type in some questions. So next month on September 10th, we will have one of Rural Beginnings clinical supervisors, Elizabeth Sheets. She'll be presenting Navigating Community Outings, ABA Strategies for Success. So hopefully you are all able to make it. And I think I saw a question pop in. Oh, it was a thank you, Dr. P. And can we get a copy of the slides? So if that's the case, Dr. Hoyle, we can probably have you send, I'll just take your slides that I have access to. If that's fine with you, we can send that out with the recording to anybody that's missed it. Awesome. Cool.
Absolutely. And the slides have access to the link to the podcast too. So
Perfect.
yeah.
Awesome. Are there any other questions before we end for this evening? We'll give it another minute or so here.
Yeah, absolutely. Thank you, everybody.
We got another thank you and a see you on 9/10. Awesome. I'm excited to see you. Thank you for coming to our Autism Exploration series. We love being able to offer this to all of our families at VB and outside of VB. We'll have to do another get to know our audience, see where everybody's coming from too. Cool. I don't see any other questions funneling in, Dr. Hoyle, so I think it's safe to call it for the evening and let everybody carry on with the rest of their week. I just want to give you a huge thank you. This was really great content, and I mean, several people have already said thank you, but I want to thank you on behalf of everybody as well. This was really fantastic. Great to hear about mindfulness and ways to implement that within play. And, I have a special place for this because I was part of your dissertation. So getting a chance to see it from a family facing perspective is really, really neat. So thank you. I really appreciate you. And hopefully we can have you present for us again in the near future.
Yes. Thank you, everybody. See you.
All right, everybody. Have a great evening.